We're going to bring our panel discussion up, which I'm excited about. I think my little role here is to kind of hopefully dovetail everything together, really speak to what we were frankly trying to accomplish here today, which is the only real cure for complacency is anxiety. And we kind of want anxiety in this space because we've been complacent. I think we've all been complacent in our own roles, either by choice or by force. And I think what we wanted today was everybody to come and hear opinions they either agree or don't agree with, but to acknowledge the fact that things are going to change. We've had complacency for a number of years for whatever reason, but there is an open window that has started, and it has been spurred in some way by healthcare reform, but frankly has been spurred a lot by just a need to do something differently. And there's an opportunity for change to happen now moving forward. We don't know what it's going to look like. And what we don't want is people that can provide meaningful input in what that change looks like to be complacent. I want you anxious. I want you thinking about the way things ought to be, and I want you talking about it and trying to make some change as we move forward. So this is really short. This is my inspirational point as we look at all of these thoughts that we've heard here today, and then we'll finish it off by some solutions that we're going to hear in a bit. But all of the great leaders have had one characteristic in common, and it was the willingness to confront unequivocally the major anxiety of their people and their time. And this and not much else is the essence of leadership. So I put this in almost all my presentations because rising healthcare costs, undoubtedly, they already are, if not one of the biggest anxiety of our people in our time. And they will be for our children and our children's children. And we need leadership in this space right now to do something about it as we move forward. So the question really for everybody in this room is who's going to lead us? Are we going to sit back and allow things to happen? Or are we going to start talking, moving, making things happen to make meaningful change? I'm happy, and that's what I'm excited even about the people that we're going to have up here in a bit. They've done something. They've done something different today than they were doing yesterday. And we're going to hear about the highs and lows of it, and there's probably both. But it doesn't change the fact that they've done something. And I would encourage everybody to do something tomorrow. As a result to it. We had healthcare reform. Again, this is my little metaphor picture, which I always find funny, because this is what I often saw health reform about. Whether you're for it or against it, it's not a political statement, but we had all these people talking about what was going to happen, and then this is me kind of in the background there, watching two guys play catch with a hand grenade, right? And they're talking about it, and we focused on it, and it's not really the big issue, because if you have the right perspective, the bear's the big problem. Whether that hand grenade goes off or the pin's in it is the question. The bear's going to get somebody. And the health of this country is really a much larger problem than healthcare reform has been. The government said through healthcare reform, in many ways, we don't know what's going to happen. We're going to ask you to do it. And if you watch, this is my little addition here. Right? It's kind of funny. I think that's awesome. Because I want the people in this room to do something about it. I think the people in this room are probably better equipped to do something meaningful than Uncle Sam is. Healthcare reform isn't the issue. What the issue is a healthcare revolution or a health revolution in this country. Whether you agree with the people before and whether you agree with the panelists, things are going to be different. And they need to be different. And we want you to do something that's different moving forward. A revolution is defined as an activity or movement designed to affect fundamental change in a socioeconomic situation. That's healthcare cost. We need fundamental changes in what is now a socioeconomic situation in this country. And so I'm not going to bore you with this. I do this all over. But this is really an indictment maybe on our healthcare system as it's impacted our health through one comorbidity, which is obesity. And interesting to point, somebody up top, I couldn't see with the lights, but there's a lot of comorbidities. Obesity is one. We have found, because we collect a lot of data, case management is a comorbidity, not in the sense that it negatively impacts change, but we are tracking it to see how it positively impacts outcomes with our patients. So does it mean that when it's case managed, we're getting them sooner? I think one of the problems with case management in particular is some employers are waiting until it's too late to associate the case manager to the situation, and then it's 300 days post-injury, and the ability to get a really good outcome is impacted by that. The reality of the data, just like for us as a physical therapy, as case managers, is the data eventually will prove value. And there's differences among case managers, just like there's differences among physical therapy providers and doctors and everybody else. But we have to look at the data in the same light and really make it fair data to analyze. This, though, is what it is. This is the health of this country. These are obesity rates. You're just going to see over a 5-year span. In 85, healthcare cost percentage of GDP were 10%. Obesity, which is a major indicator of health, is there. Light blue is 10% of those states were obese. Green is 10 to 14%. Go to 90, this is what our country looked like. Go to 95, 2000, and now 2005, that's where we're at. And now you look at the last year we have meaningful data for is 2010. Healthcare costs as a percentage of GDP are almost 18%, and this is the health of our country. Now, I'm not saying the healthcare providers have had everything to do with this, but we're a part of it. And what we have to acknowledge is the way that we've done business needs to be different, just like the way everybody else in the system has to do it differently. I'm going to go through this quickly because I want to get the panelists up here, but the data is going to continue to trend in that way unless we do something meaningful about it. This, as it impacts workers' comp, is really significant because that obesity data I just showed you, there's a 2007 Duke study that talks about the costs associated with that obesity. So if you had a recommended BMI, there were 5-point injury claims per 100 employees. If they had a BMI over 40, there were twice as many. If you had a recommended BMI, the average claim cost was $7,503. If you had a BMI over 40, the average claim cost was $51,000. Obesity is a work comp situation. If you really want to impact comp, if you want to do something about it, you have to stop looking in the narrow landscape that we have and really expand the way that we look at addressing employee health. Same with productivity. It's profoundly increased. 14 lost work days per 100 employees of an average BMI, 190 or 183 lost work days per 100 for those over. It impacts every level of cost in an employer. It's shared. Since 2005, wages have only gone up 18% for most employees, where their healthcare costs or percentage shared has gone up 47%. Our employees have less money in their pocket because we haven't done things differently. What they're getting for their money is less. Higher deductibles. We're just passing these costs around, and we have to start looking at them. When we look locally, Missouri and Kansas, as a small business owner, I'll tell you, this is one of the things that scares me the most. Missouri is one of the least healthy states in the country. My healthcare rates are done on a community base, so they're looked at because I'm a small employer. I'm paying for the health of Missouri. And it's not a very healthy state, so I'm paying more. Kansas is a little bit better, but trending worse. So our region is at a significant issue right now. We're on a cliff. And you look at what's happening around us from a socioeconomic standpoint, not a healthcare standpoint. The states around us, Missouri, I'm an Iowa guy, so I'm going to take Iowa in particular. Governor Branstad has said, Missouri's 40, Kansas is 26, Iowa's going to be 1. We're not going to be 2, we're not going to be 3, we're going to be number 1. And we're going to do it because businesses like Matt's and everybody else are going to move to Iowa and do business here because they can afford health care better. And it's one of their biggest costs. Now you look at these other states around us, Illinois, Nebraska. Illinois is Chicago's doing a huge deal right now where they're really looking at their health care costs and addressing it, not because they care what we look like in our bathing suits, but for socioeconomic situation, for money, for economics, for businesses, and for where those regions are going. This was referred to before, but the definition of insanity, right, is doing the same thing over and over and expecting different results. Today, hopefully you're motivated for change. We need a health revolution in Kansas City, and we need it to be an issue that's not aimed at very specific things, but we're looking at fundamental changes in a socioeconomic situation in this community. So, really quickly, the federal government agrees with you. This was the first wellness grant. 10 million came from it. 190 supposedly are coming behind it. But this is the federal government saying, Matt's right. I don't think they're really saying Matt's right, but they're at least agreeing with my philosophy, right? That workplace health promotion programs are more likely to be successful if occupational safety and health is considered in their design and execution. Integrating and coordinating occupational safety with health and health promotion may increase program, et cetera, et cetera, et cetera, et cetera. This is on page 1 of the first grant. They know that work comp and group health are coming together, and they know that we've got to look at it in a different way. And they're looking for solution providers. So what does that mean? It means a lot of things, but what it means is as you look at all of your healthcare costs for your employees, don't just focus on group health, don't just focus on work comp, put them together and look at meaningful data to decide how is the health of my employees trending and what providers am I using to support that and why? Why am I using those providers? It looks like coordinating group health care costs, workers' compensation costs, coordinated pharmacology among those trends. Are we looking at somebody who gets a certain drug from work comp doctor and a certain drug from a group health doctor, and maybe those drugs are contraindicated? The employer has an opportunity to really look at that from a meaningful way about the health of their employees. Their medical team, who do you collaborate with and why? Do you have a medical team? Why? Do you use those people? And culture. What do you do within your organization? It starts from our perspective with job analysis, post-offer employment testing, and we're going to have some people up here that have had tremendous success with that because it impacts both sides. Provider relationships, who you use and why, and changing the way in which you look at it and understanding those aren't disparate pieces. Those are all part of the same continuum. We're going to stop looking at them separately, and we're going to ask and mandate that all of our people work together. So, where are we at competitively? Rahm Emanuel used to be the President's Chief of Staff, has one of the largest municipal-based wellness programs started right now in the city of Chicago. General Electric has a smoking surcharge. If you smoke, I think it's $720 or something on their deal. St. Luke's Health System program, which is if you smoke, you don't work here. If you start smoking while you're here, you're fired, are just little examples of employers that are starting to get ahead of it. Now you talk about accountable care organizations or medical homes with employers finding medical providers. Ms. Booth's going to talk to you here a little bit about choosing medical providers and why they brought that in-house and how that's meaningful for them. It's all coming to this type of a deal, which is this is a Volkswagen plant in Chattanooga, Tennessee. And this is 3 months before the production line opened. But they are now looking at their employees, and this is a 4-hour workout program that they do before the production line was built. They expect those employees to be healthy. It's part of their culture. They expect them to be able to do certain physical things because that's what the job calls for. And the employer refuses to sit and close their eyes, ears, and pretend like they don't have physical demands. And this is just one way in which employers are getting ahead of it. And this will drive the competitive marketplace. Volkswagen doesn't do this for any other reason than they think they're going to make money off of it. That's why, and that's okay. But they understand the comprehensive nature of how they work with all their people. So again, all of the great leaders have had one characteristic in common. Rising healthcare costs will be our major concern. And we know that from the past, all of us, me included, have existed within a system in which 95 cents of every dollar is spent on reactive care and 5 cents on preventative. Leadership's got to change that. And so the question is, will all of you lead us today when you move out of this place? If we do that, and we do that meaningful in Kansas City, I think we can change this flight that I'm concerned about and make Kansas City where all the other places come to, and we make this economy different. And we do it with the professionals that are in this room that have something meaningful and accurate to say about healthcare. Because that's when we win as a region. So this is my little closing. Why do I do this? Sure, it impacts the business. I love ARC and I believe in ARC, but this isn't why that we talk about this and brought you here today. It is literally for these people, and all of us could put our own family picture up here, right? This is my family. And this is the reason why it's so meaningful to me to bring the people that have been here before, the people that are coming up here in a little bit, to talk about innovation in a new way in healthcare. Because Carrie and I are going to be okay, but these people are the ones that are going to pay for the sins of our generation. Or pay for the lack, the apathy, or reap the benefits of the action that happens right now. And what happens is all of this changes. So even since I first put this up a few presentations ago, this slide has changed, and now it's that guy, right? And I think that all of us have to look at these discussions in that same way. Put your picture up here, because that's what we're doing it for. And apathy and lethargy and complacency, maybe we could get by, but they will not unless we do something about it moving forward. So with that, that's all I have to say. If we could have the panel come up, because I'm really excited. We've talked about issues specifically. We've had speakers talk about philosophies and ideas, but what we've got an opportunity now is to pull up 4 people that have done it in their workplace.